Alright, so we had the perio check with the professor, and she agreed with my probe depths that I got and assessed everything that I showed her. So it looks like your periodontal diagnosis is a stage 2, grade B. So basically what that means is that you have a little bit deeper pocket depths than you would want to see in a healthy patient. So these 4s and occasional 5. We want to see more 2s and 3s in that area. So, and then grade B is referring to the rate of progression for bone loss and other kinds of attachment loss. So grade B also encompasses your smoking. So that kind of bumps you up to the next risk level.
Right.
Because your smoking will affect your attachment loss. It'll increase the inflammation, and your body will start to attack those tissues even more.
Healthy.
Yeah. So if you're, already like periodontically compromised because of the calculus of the tartar buildup in your mouth, the smoking is going to make it worse. And so we also decided on a calculus level of 0.4. So we have 0.1, 0.2, 0.3, and 0.4. So 0.4 is like the highest level of calculus that you can have. So due to that, we are going to suggest that we do Nspt, which is non-surgical periodontal therapy. So what we're going to do is we're going to numb you up, and quad by quad, so we're going to split up your mouth into 4 sections, and each section we're going to take 1 appointment to do, since it's a little bit more involved than we can do in 1 session. So we're going to do that. It's going to take 4 appointments, so 1 for each, and then we're going to see you back in January for a PSE, which is where we just evaluate everything, how everything's doing since we finished NSVT, if there are areas you need to go back to, if there's residual calculus or anything like that. We'll talk about home care, and we'll do like varnish and that kind of stuff. So I already talked with you about home care a little bit, and we want to start doing a lot more home care in those areas that I've already done. So we want to keep them nice and healthy and tighten up those tissues so we can get those 3mm pockets when you come back.
Sweet.
And yeah, so do you have any questions?
Yeah. What's the difference between NSPT and regular cleaning?
So during a regular cleaning, when we have lower pocket depths or fewer pocket depths and less calculus, we don't do local anesthetic, so we don't numb you up because it's relatively painless. But when we have a lot of deeper pockets and a lot of calculus, it can get a little bit painful, a little bit bloody, but so we want to numb you up